Happening at midnight, the mask mandate lifted for those who are fully vaccinated. The City County Council tonight approving that change at their meeting. Now, if you have not been vaccinated yet, you still need to mask up here in Marion County. The council also tonight easing capacity restrictions. As our Emily Longnecker tells us, some places will finally be able to open their doors.
Well, it was a big night here at the City County building for a few reasons. The first, this was the first time in over a year that the City County Council met in person. The second, council voted to lift the mask mandate for those who are fully vaccinated.
We will be voting on proposal number 195, which ratifies public health orders related to COVID-19.
You're listening to the votes 18-5 from the Indianapolis City County Council that Marion County Public Health Director Dr. Virginia Kane says marked the start of returning to some sense of normal. The CDC recommended last month fully vaccinated people could remove their masks.
That's why tonight I am recommending that we lift Marion County's mask mandate for fully vaccinated individuals.
Once the mayor signs the new order, Hoosiers who are fully vaccinated will not have to wear a mask in Marion County unless a business or venue requests it. Masks will still be mandatory at hospitals, public transportation, and at the Indianapolis International Airport.
This is truly a milestone for the Indianapolis community.
Some counselors questioned the new order.
Why not just remove the mask mandate for everyone when it's not possible to enforce who is vaccinated and who's not?
There's so many gray areas that it's time to just lift the restrictions.
Monday's vote also tackled capacity restrictions. Indoor services at bars and restaurants will go to 75% capacity. It's the same for entertainment and cultural venues. Religious services and funerals, which are now at 75% capacity, will go to 100%. When public pools open for the summer, they will also be allowed at 100% capacity.
The health department will recommend the full reopening of our community when we reach a rate of 50% fully vaccinated residents.
The goal for that is July 4th.
Not everyone is willing to ditch their face mask just yet. There's a new Gallup poll that's out tonight showing that people want to get out there, but they want to do it cautiously. 79% of people surveyed say they've worn a mask during the past week. Now that sounds high, but it's still down from 86% back in April and 90% in previous months. So who are the people most willing to mask up? Gallup found about half of the people who don't plan on getting vaccinated are the ones not masking up, despite CDC guidelines. About 90% of those fully vaccinated are still wearing their masks when it's needed. Now, COVID restrictions are easing up tonight, in part because we're seeing more Hoosiers getting vaccinated. Across Indiana, more than 44% of eligible Hoosiers are tonight fully vaccinated. Here in Marion County, it's just under 44%. If you still need a vaccine, you can get more information by scanning that QR code there that you see on the bottom half of your screen with your cell phone camera. As more Americans get vaccinated, they want proof that the shot is actually working. Now, there are some people who are saying that antibody tests reveal whether or not you are protected from COVID-19. So our verified team went straight to the experts to get the answers.
You may remember last year, antibody tests got a lot of attention as folks wanted to figure out if they'd had COVID and were protected from the virus. Now, antibody tests are back in the spotlight, this time related to vaccine protection. So let's verify. Can an antibody test prove if you're protected by the COVID vaccines? Our sources: an infectious disease epidemiologist, an infectious disease physician, a research fellow, and a rheumatologist. Experts think antibodies are a key part of COVID protection. Recent studies show a direct connection between antibody level and COVID immunity.
Not only are you producing many antibodies, but those antibodies are then able to actually neutralize the virus, which is what we need them to do. But Dr. Emily Ricotta, an infectious disease epidemiologist, says testing individuals for immunity is tricky. Because we don't know what these results really mean. A key concern is the correlate of protection. That's the number of antibodies the average person needs to be protected from COVID. The problem? Experts don't know that number, and they say most commercial antibody tests only offer vague information about your levels. So we can't just say, oh, you have antibodies, ergo you're protected.
On the flip side, those with no antibodies after vaccination may still be protected. That's because your body should produce two things in response to a COVID vaccine: antibodies and T cells. The antibodies protect you from ever getting COVID, and T cells keep you from getting sick once you have the virus. Even if you have no antibodies, experts say you may have enough T cells to be protected from symptomatic COVID.
That's equally important when it comes to a vaccine response.
Dr. Amish Adalja is an infectious disease physician at Johns Hopkins.
There's a reason to be worried if you don't have antibodies after a vaccine, but it's not the whole picture. You'd have to couple that with knowledge about the person's T cell reactivity.
T cell tests exist, but they're hard to come by. And just like with antibodies, experts don't have a correlate of protection, meaning they don't know how many T cells you need to be immune.
I think we need a lot more data to understand what the phenomenon is that's going on.
That's a key reason the FDA does not recommend people test their antibody level to assess COVID immunity after vaccination. But some doctors are testing immunocompromised patients to better advise them. Dr. Victoria Shammigan is the director of rheumatology at George Washington University.
Obviously, it doesn't measure everything, but it just gives you a guide of how strong was their response to the vaccine.
But even that strategy is being debated.
I do think that's a reasonable approach.
Dr. Brian Boyarsky is a research fellow at Johns Hopkins studying antibodies in immunocompromised people.
It's much more information to know that someone doesn't have any antibodies at all.
I think we don't have a strong enough evidence base to recommend this.
Dr. Adalja is skeptical of offering advice to immunocompromised patients based on antibody tests.
It's fine if they want to do it, but I just would do it with the caveat that it's unclear what it actually means.
So we can verify antibodies are a big part of this protection puzzle. But right now, antibody tests alone can't prove whether or not you're protected by the COVID vaccines. With your Verify, I'm Gabe.
And if you've got something you'd like us to verify, just send us an email, verify@WTHR.com, or you can send us a message on Facebook or Twitter.